Hello, welcome. My name is Anna Whetsel Rucker. I'm a doula, a hypnobirthing child birth instructor, educator. Today I'm going to speak to you about how hypnosis works in pregnancy, childbirth, and postpartum. Let me tell you a little bit about myself. I'm the founder of Mama Ree's Doula Services. I became a certified professional doula in 2013. I became a certified hypnobirthing childbirth educator in 2017, and I have enjoyed teaching it since then. And last month, I became a certified birth trauma support facilitator. Those group sessions will be coming soon, but today we're talking about how hypnosis can help you. Marie Mongan, also known as Mickey, that's what we called her, that was her nickname. She created hypnobirthing over 34 years ago. It's worldwide. It's the only one that is completely worldwide and the longest running hypnobirthing program. Let me tell you a little bit about Marie. We did lose her last year. She was 86 years old. So she had lived a full life. She had 4 children. She'd lived in Canada, and then she moved to California. In California, this was around 1950s. This is when, most models of care for pregnant women and childbearing women were in the hospitals. She had 2 in the hospital. She did not like it because they put her to sleep. Her husband wasn't allowed, and it was just all medical, and pregnancy and childbirth is not a problem. It's not a sickness, a disease. So being a hypnotherapist, a licensed hypnotherapist and counselor, she created this program, started creating this program. So by the time she had her 3rd child, she went to the doctor and she said, look, I want to stay awake. I want to breathe my baby down. I'm going to use hypnosis for my surges, contractions. She changed the wording from contractions to surges. It just sounds so much nicer. Contractions, you think of fear and pain. So she said, during my surges, I'm going to use hypnosis. And the doctor laughed, and she said, well, if you can't do it, I'll find someone who can. And she got up to walk away, and he said, okay, hold on, Mickey, hold on. And so he agreed to that. And she said, one more thing. I want my husband in there. And he was like, absolutely not. It's not heard of. However, he did finally agree. When she got to the hospital, she was telling the nurses what was going on. And before she knew it, the nurses still gave her medicine and knocked her out. So her 4th child, Mara Geddes, who is now co-CEO of Hypnobirthing International, she explained it all again. But this time when she got there, she refused an IV. That way they could not sneak medicines in. And she had a wonderful, amazing hypnobirth. The doctors and nurses had never seen anything like it. But like the newest phenomenons, they're on it for a little bit and then the next thing comes along and they forget about it. But Marie did not. She created her program and started teaching. Hypnobirthing's been on the Today Show, ABC, CBS, all kinds. In parenting Today. So it's coast to coast. Australia is our 2nd biggest hypnobirthing, even though it's so much smaller than the United States. It's really big there. Let me tell you a little story or some history about hypnosis. It's been around since the 18th century. And so by the 1840s, hypnosis started being used for childbirth. Surprisingly, there was even cases in the 1950s where childbirth, women had to have a C-section, a cesarean section. There was research published in the mid 1850s. I have a typo there. It says 1950s. My apologies. It's the 1850s. 1850. Medical hypnosis was being done for those who could not tolerate anesthesia. They were doing medical hypnosis for surgeries. They even started doing a medical hypnosis for cesarean sections in the late 1850s. All hypnosis is self-hypnosis. It's a deepened state of relaxation, as in a meditation, or if you remember being in school, looking dreamily out the window, daydreaming, you get in trouble for it. That state that you're in, that your brain waves are in, that is a self-hypnosis. It's usually in the theta and delta frequency waves. This deep relaxation is brought on by visualization, unique breathing, affirmations. This calms the autonomic nervous system. And here I show the awake, normal, alert, conscious state is the beta. Alpha is when you're relaxed and calm, meditation. Theta is when you're in deep relaxation and meditation. And delta is the dreamless sleep. This is where you have those wonderful feeling dreams and you wake up and you can't remember anything. This is where you get your good deep sleep from, your resting sleep. The benefits of hypnobirthing, benefits of hypnosis. They've been known to have, moms and pregnant persons have been known to have healthier pregnancies, less preeclampsia, less gestational diabetes. This is all cause for fewer interventions, fewer cesarean sections, fewer inductions. There's also less need for pain meds and epidurals. Shorter labors are noticed, fewer premature babies, fewer cases of postpartum depression, happier and more content birthing people and babies. Also, one of the main benefits is less birth trauma. During your birth preparations, there's a lot of processes that your body has to go through. There's a physical, a hormonal, emotional processes. There's pain relieving techniques, labor positions, birthing positions, and you learn how to navigate the whole system. It's about getting informed, getting educated. It's about becoming empowered, finding the power within yourself to have a safe and gentle birth. The mindset you will develop, you will be free of fear. You will know how to surrender and release your body to do what it normally does. You will trust your body and your birthing team. And your birthing team is someone that you choose. You choose your hospital, you choose your provider, you choose your birth companion. And with COVID, most places, most hospitals, birth centers are only allowing one birth companion. Some are allowing doulas in, as seeing those as necessary participants, non-medical participants. You and your companion will know what to do if you hit a wall, if they are saying your labor has stalled, if they're saying there's failure to progress. Hypnosis releases fears. It changes your perception of pain. It allows birth to be shorter and more comfortable. You will have this whole new mindset. A hypnotized person is not unconscious or asleep. You will not be submissive to another person's will, to my will. I cannot make you rub a back. I cannot make you tell me your deepest, darkest family secrets. None of that. You won't be in a freaky trance. Um, you won't lose your memory. You will remember everything. What a hypnotized person is, you're totally conscious, but you're working in your subconscious. You are in full control the whole time. You are consenting participant. You are fully and deeply relaxed. You're aware of your surroundings, but you choose to stay in the subconscious, the deep, relaxed state. Like I said, you can remember everything, and it's a learning state for your body and your mind. Now, about the hypnobirthing course, the Marie Mongan method that I do teach, there's 5 models of childbirth education. They're 2.5 hours each. You meet weekly for 5 consecutive weeks. It's more of a philosophy than a technique. One of Marie's favorite quotes that I love is, when a mother is properly prepared for birthing, physically, mentally, and spiritually, she can experience the joy of both birthing her baby in an easier, more comfortable way. Labor and birthing. Birth is natural. It's normal. It's healthy. It's a physiological, natural thing. Birth has a natural rhythm and flow about it. This is one of my mothers. She was in complete relaxation. She was 8 centimeters here, which is considered transitioning, or nearly complete. Now, what we teach in the hypnobirthing method, model 1, is the theory behind the hypnobirthing. That teaches you a lot of the science to let you know that this is just not some woo-woo, hippy-dippy stuff. This is real scientific, evidence-based work. Model 2 will teach you the techniques. You will learn the 3 different breathing techniques. There's calm breathing, birth breathing, and J breathing. You will learn deep relaxation and hypnosis. Module 4, labor from start to finish. We go through what happens to your body, what's chemically happening in your body, what happens to your mind, what could happen hormonally. How do you deal with those hormones and emotions? And module 5 is the birth, bonding, and breastfeeding, the 4th trimester. We talk about the golden hour, how it's so important for skin-to-skin contact to let baby latch on. These are some more hypnobirthing babies. The one on the left happens to be my latest grandson. He will be 2 in October. This was 2 days old, the baby on the left. Now the baby on the right, this one was just born. She's not even 2 weeks old. She was 20 minutes old there. Look how alert. When there is no need for anesthetics, analgesics, no inductions, no chemicals induced into the baby through the mother's system, through the placenta. This is what an alert baby looks like. Now, the calm, relaxed, normal, sympathetic nerve system, the benefits, the endorphins are running high. The catecholamines are restricted. Baby and mother are both comfortable. There's no assault on mom or baby's body, meaning there's no accelerated heart rates. There's no trouble breathing. There's no need for meds to reduce the pain. It's often totally eliminated. The 1st and 2nd phases of labor are shorter, and you can recover quicker from a surgical birth. Your digestive system is normal. It's not stopped or put on hold as if you were in the parasympathetic. You're happy, healthy, mom, baby's happy and healthy. But if you're in the parasympathetic, that's the flight, fight, freeze, fawn, which means fainting. Um, you just freeze up. Your blood, your O2, oxygen, blood levels are redirected to the defensive muscles. And your defensive muscles are your legs and arms. That was created so if a saber-toothed tiger was chasing us, that's where the blood and oxygen needed to go so we could get away. We don't need that here. So we need to go into our hypnosis, hypnotic state, amnesic state, and we can be in our sympathetic nervous system. The uterine muscles need the blood. So if the blood is in the defensive muscles, this does not help baby or mom. The uterine muscles become very oxygen deprived, and that can cause pain. That can cause cramping. When you get a leg cramp in the middle of the night, one of the first things you do, I was always told, jump up, walk on it. So you jump up, but when you get up, the first thing you do is you take in oxygen. That goes to that leg because you are in a parasympathetic, a fight, flight, or freeze. You are jolted out of your sleep with that cramp. So the oxygen will go to that pain. With the oxygen not in the uterus, it can cramp and become tight and hurt. Labor can be prolonged. There can be failure to progress, mother and baby heart decelerations or accelerations. Mother and baby can both go into distress. There could be need for augmentation or surgery. Now, in 1920, Dick Grantley Reed created FTP, not failure to progress, fear, tension, pain syndrome. He believed that if there was a fear, which most of the time there is a fear of birthing from, our aunties, our mothers, what everyone has told us, you have that fear. It turns into pain because you tense up. And when you tense up, there's more pain. If there's more pain, there's more fear, and it keeps going into a vicious cycle. With hypnobirthing, you learn to release that fear. You can have a fearless or fear-free birth. Without the fear, there's not the tension. There's not the pain. The birth companion during hypnobirthing, they know how to support mom or the birthing person physically and mentally. They know how to create a perfect birth plan, birth environment. What's important? Dim the lights, no loud noise, no interventions, knows lots of techniques to help with the relaxation and any pain relief. They understand how to advocate for the birth preferences. This is very important. The mother will be deep within herself in her amnesic state, in her hypnosis, her self-hypnosis, and they need someone to advocate for them. If the nurse comes in and says the doctor wants to start Pitocin, the dad or the birth companion, whomever that is, can talk with the nurse and let them know, this is what our choices are. Let's give her a few more minutes. Let's give her an hour. Let's see, they use what's called brains, benefits, risks. Where was I at? Oh, they use their brains. They weigh the benefits and risks. Anything else is there anything else that can be used? They use their instinct. And what happens if they choose to do nothing? And and let labor progress naturally. Let me go back just a little bit. Okay. From the beginning of the pre-labor, which is known as Braxton Hicks, to breathing your baby down, to birthing your baby out. Hypnosis, hypnobirthing was tailor-made just for you. You use the unique breathing techniques, affirmations, visualizations to get into this deep and relaxed state of self-hypnosis. Using any number of hypnosises to get you into a hypnosis that will take your body through all the surges that comes in labor and birthing your baby. Hypnosis will work in turning off the catecholamines. That's the parasympathetic nerve system. This would be adrenaline, cortisol. They work to turn on the body's natural oxytocin, the love hormone. The love hormone is what helps baby be born. I've had so many tell me that all they had to do was let go and let their body do what it was made to do. And I have also seen mothers go through their labor and birthing with only some tightening, some pressure, especially when baby goes through the birth canal. But none of them talked about, you know, the severe pain that most birthing people speak of. As your body progresses deep into labor, while it's thinning and opening, or what some know as dilating and effacing, there's many chemicals and physical changes that's happening. Your uterus is contracting, squeezing your baby down into the birth canal. So let's go into postpartum and hypnosis. Your baby's come. You have had your golden hour. Baby is latching, or maybe not. Sometimes you do have to ask for help, and that is okay. Part of, and most important, is know how to get the support you need. Plan ahead while you're pregnant. There's so many challenges of a new parent. It could be trying. You're taking care of a newborn 24/7. You're nursing, changing diapers, bathing, burping. You're trying to take care of yourself. You realize that shower has become a luxury. You realize that there's still the cooking, cleaning, laundry to do. There is so much that is incorporated that you did not expect, and that's okay. That's why you plan ahead and you ask for help. When you are in a relaxed state, you are better equipped to deal with the daily going-ons in your house. When a baby is ready to nurse, sometimes that can be frustrating if they don't latch on. You can get nervous, you can get anxious. Using even a 5-minute hypnosis can calm you down enough to relax and get back to that homeostasis that your body knows. When you plan ahead, have your hypnosis tracks downloaded or pre-selected from YouTube. Remember to schedule your self-care in. Yes, babies eat on their time. They sleep on their time. As soon as another adult's there available and baby's asleep, if you're not sleeping, take that time to get your shower. Take that time to sleep and relax. Self-care is so important. Be sure to reach out for help. In each city, town, county, there's usually a La Leche League group. You can go to www.lalecheleague.com or your local international board certified lactation consultant. Most hospitals have these. I know that Roanoke does and Lewis Gale does. You can call even after you've delivered to get tips and advice. You can make appointments and go back in if you're having trouble with the latch. But getting into that deep and relaxed state, playing some nice relaxing music is not only just good for you, but it's good for baby. So I want to thank you for joining me, but first I do want to try brief hypnosis. What I would like for you to do is take a deep breath in through your nose and out through your nose. Do some calm, relaxing breaths. There you go. Do a couple more. Deep in. Release out. Feel your belly breathing out. Filling up, up, up. There you go. Release. Okay, gently close your eyes. And as you gently close your eyes, I want you to relax your forehead. Release any tensions that you may feel there. There you go. Release and relax. Any muscle tensions in your eyes. Keep your eyes gently closed, not forcefully. Relax your cheeks, your jaws. Relax your neck and your shoulders. Release any tension all the way down into your body, down into your body. Release and relax any tension in your upper arms. Let it flow down through your elbow, your lower arms, your wrist. Breathing normal and natural. Release the rest of that tension out through your hands, all the way out through your fingers. You can wiggle them if you choose. Let all that tension go. Let's go back and release any tension at the base of your neck, your shoulder blades, the top of your back there, the middle of your back, your lower back. Release it down into your body. That's it. Now release your chest muscles. Breathe away that relaxation. Let it go down, deep down through your body. Release your solar plexus. Any tension you may feel in your stomach, your abdomen, release it now. Release your pelvic area. Release your sacral. All the tiny ligaments and muscles around, down into your legs. Relax and release. Let the tension flow down through the top and the back of your legs, the knee, the well behind your knee, your shins and your calves, down through your ankles, out through your feet, the tops and the soles of your feet, all the way out through your toes. Scan your body one more time. See if there's any tension. Anywhere in your body. Release and relax. Just let it flow out. Nice and relaxed. So in your mind's eye, I want you to imagine you're in a kitchen, any kitchen that gives you the most safest feeling, the most comfortable. It can be a kitchen from your past, or it can be a kitchen now. You can smell the food cooking. You can see the steam condensation on the windows. It's warm from the food cooking. It smells so amazing. This is one of your most happiest times. As you walk over to the counter, you see a cutting board with a beautiful bright yellow lemon. You pick it up and you can feel the texture of the lemon. It feels waxy, but still natural. You put it down again and notice that there is a knife beside of it. So you go ahead and cut it in half. You see the juice flow down on the cutting board. It looks so good. You bring it up to your nose and you smell it. It smells so fresh The smell making you alert. And now you sink your teeth deep into the lemon. You feel the juices flowing around your mouth, around your tongue. And you put the lemon down and begin to leave the kitchen. So as you're leaving your kitchen, you're coming back to the room you're in now. I'm going to count up to 5. When I get to 5, you will be physically alert, mentally awake, totally relaxed. 1, you can feel the chair or couch that you're sitting on. 2, you're aware of the surroundings around you. You can hear. 3, start to wiggle your fingers and toes. 4, open your eyes when you're ready. 5, physically alert, mentally awake, totally relaxed. Now I want to ask you some questions. Whose kitchen did you go to and why? I always went to my grandmother's kitchen. This was done twice. Each hypnobirthing educator training, they do this. And it is part of the hypnobirthing childbirth class as well. So what smells did you smell? Could you smell them? Could you see the condensation? Could you hear the loudness of the kitchen or the quietness? When you saw the lemon and you felt it, how did it feel? Now, when you tasted the lemon, when you sunk your teeth into the lemon, what happened? I cannot hear the word lemon today without my mouth starting to salivate, starting to water. And it's because of this hypnosis. But this goes to show you how the mind-body connection works. I do want to go back and teaching the theory behind hypnobirthing. There is what is known the psychophysical, the law of psychophysical association. What this states is for what or any mental thoughts, what you think, what you feel, what you hear, it changes into a physical, chemical, or biological reaction in the body. And doing the lemon technique that basically just proved the point. You know, you thought about the lemon, you cut open the lemon, you saw yourself doing that, You sunk your teeth into the lemon. So what your mind thought about the lemon created a physical reaction in your body. So that's one way that hypnosis works. This works throughout your pregnancy to keep calm, keep your blood pressure under control. You know, when you go in and there's the white coat blood pressure that's higher than normal, do some of the calm breathing. Do some research if you're not taking the class. It's like a yogic breathing, in through your nose, out through your mouth. Do that about 5 to 10 minutes before you go in to see the doctor and the nurse. And your blood pressure will go down significantly. It will be of a normal rate. It helps steering when you're nauseated because it gives you something else to focus on. If you go into a hypnosis and within your hypnosis, you're telling yourself, I'm perfectly healthy. I have no nausea. My stomach is well. It does, eventually, it does work. Sometimes it takes a few times, 2 to 3 times. In childbirth, it's perfect. From early to the Latin stage to transition, mothers learn to go deep into relaxation using various hypnosis. They learn to use the breathing techniques that will help them breathe their baby down. And again, in postpartum, you can learn to calm yourself and your baby, to nurse like a champ. Okay, I'm grateful you're here. Here is my information. Again, I'm Anna Whetsel Rucker, doula, hypnobirthing, childbirth educator. My business is Mama Ree's Doula Services. My email is birthwithmamarie@gmail.com. My phone number is 540-320-5660. And my website is www.mamareedoula.com. I have a Facebook account. Of course, you go to Facebook, then /mamarees.doula.services. On Instagram, it's just mamarie.doula. And Twitter is @mamarie_doula. I appreciate you tuning in, listening to my thoughts. Call me, text me, email me, or find a class. We are teaching all online till the end of the year, which has been approved through the Institute due to the COVID crisis. Thank you and have a blessed day.